Angie Lafier with Orthopaedic Rehab Specialist is joining us today. Angie, there's this perception that falls just happen because you're old. Is that reality?
No, that's actually a pretty common myth. We do see some changes in muscle mass and strength in our balance as we age, but that's usually a result of inactivity. So there are definitely some steps you can take to maintain your strength, maintain your balance skills as you age.
Yeah.
So how do I know that a loved one or even myself may be at risk for falling? And if that is the case, what should I do about it?
Sure. There's some pretty common risk factors that are observable. So one of the main things that we look for is if you've had a fall in the past year, you're at an increased risk for falls. If you happen to use an adaptive device of some sort, so like a cane or a walker, or you notice yourself needing to use walls or furniture to kind of navigate through spaces and feel safe, that's another risk factor. And then we also look at things like your strength. If you're noticing it's harder for you to raise yourself up from a seat without using your hands, or it's harder for you to get that step up onto the curb, that could be an indicator that your strength has decreased a little bit, which does put you at risk for falls. And then another big one that we actually consider is if you are scared of falling, you have that fear, that actually does increase your risk because you may start to limit yourself in what you're doing, and then that just kind of mitigates the whole process of not doing things, not practicing things, and that just kind of puts you on a decline.
How do I protect myself or my loved ones from falling?
Sure. I think the most important first step is to empower yourself with knowledge. So finding out if you are indeed at risk for falling. There are some great resources on the web. I know our website will have some up on their site for knowing those risk factors. The National Center or National Council on Aging also has a pretty good little checklist that's easy to follow along with to see if you're at risk for falls. But basically, I think it's really important to make it a team effort. Involve your doctor, involve your pharmacist, involve your family members, and seeing if there are concerns there. Because a lot of times it's pretty simple, some of the things that you can do to keep yourself or a loved one safe.
But you kind of do notice that, for myself, as I age,
Sure.
I'll be in the shower and I'll turn and then suddenly I'm like, ooh,
Yeah.
And is that something I should worry about, or is that something that just happens naturally?
So I think it is true, like the adage, if you don't use it, you lose it. So
Come on,
I get
Bobby.
what you're saying, Angie.
if you think about as you're young, you move around a lot. So yeah.